to someone's home. We ask our folks that call for emergency or non-emergency service that they disclose that information to the first responders that arrive to be sure that we are in best circumstances to help the citizens that call. The symptoms for the COVID-19 include cough, fever, shortness of breath, or any known contact with a COVID-19 confirmed patient. We ask our folks to call, as relayed in our press conference with Chair Randall the other day with the Board of Supervisors. We ask that folks call their primary doctor if they just have questions or concerns. We ask to use 911 for emergencies and emergencies only, and again, refer to your private doctor or the health department for information. The county has set up a hotline at 703-737-8300, and that's 703-737-8300 for questions that you may have about the coronavirus and symptoms. That phone number is operated 9 to 9, Monday through Friday, and 9 to 5 on Saturday and Sunday. In addition, loudoun.gov/coronavirus maintains a valuable tool for people to get information about the coronavirus. Thank you, Chair.
Thank you. From a communications perspective, at least from a law enforcement perspective, we would like to add that residents, when possible, should file online reports. The online citizen crime reporting system allows you to submit a report without leaving your home or having a deputy have to respond. We also can take reports online and rather off the phone in certain circumstances. It's important to only file an online report if it is not an emergency or that it's not a crime that just occurred or is in progress. Online reports can be submitted to the Loudoun County Sheriff's Office, the Middleburg Police Department, and the Purcellville Police Department at our website, sheriff.loudoun.gov. Report online. We can also take reports in Leesburg if the dispatchers, if somebody calls a dispatcher and asks that to be transferred to us over at Loudoun County Dispatch. From the field, Loudoun County Sheriff's Office is taking measures in the field administratively at our Adult Detention Center, Loudoun County Courts, to ensure the well-being of staff and residents. Let me be clear, patrol and operational services are not being decreased. Although we may be limiting contact, we are committed to providing the same level of service. Based on CDC guidelines for law enforcement, our deputies may keep a distance of several feet during contact with residents. This may seem a little less friendly, but please don't be offended if we don't shake your hand when we come out to the scene. We're also closely coordinating with the Loudoun County Fire and Rescue, who we often work with on medical incidents such as traffic accidents with injuries. During the course of those events, you may be asked additional questions regarding your overall health and recent travel. From an administrative standpoint, administratively, fingerprinting services at our 4 stations are being temporarily suspended. Residents who need fingerprinting services for employment and other requirements may come to our headquarters located in Leesburg. Our staff will utilize protective gear when performing these services, just again as an abundance of caution. We're also temporarily suspending upcoming community outreach events with the exception of our Citizens Police Academy, which we believe we can do safely here in the building. From the Adult Detention Center perspective, in the Adult Detention Center, we have implemented several measures to ensure the health and well-being of the facility's inmates, staff, and visitors. We are postponing all volunteer programs in the facility to protect the staff, inmates at the facility until further direction from the CDC. Inmates will still have privilege to meet their attorney in a non-contact visitation booth. We have canceled on-site video visitation. We are still allowing tablet video visitation for friends and loved ones. All inmates have access to these tablets. This information has been posted on our front door at the Adult Detention Center. We will be reaching out to the Office of Emergency Management for the latest updates on the virus and distribute that information to our staff. A PowerPoint presentation on the coronavirus has been distributed to our staff at the ADC. We will be contacting the Public Defender's Office to give them notice of what we are enacting. All tours to the facility have been canceled until further notice. We are currently working with our contracted medical staffs in the facility to ensure that only critical medical appointments outside of the facility be conducted. We are also working closely with our medical contractor to increase the observation and assessment of all incoming inmates entering the facility. The Adult Detention Center has designated hand washing stations and signage has been placed around the facility for inmates, and staff, encouraging proper hygiene. We're also working to increase the usage of court TV to minimize the amount of inmate transfers in and out of the ADC. We're also taking measures with the Loudoun County Courts Complex. We have obtained a supply of N95 face masks and latex gloves. We have obtained extra disinfecting wipes for all of our workstations. We're in the process of obtaining current issue personal protective equipment, PPE kits, to have that on hand if needed. And Loudoun County General Service has increased the cleaning of surfaces throughout the courthouse and for the general public. Again, these measures are being taken in an abundance of caution and are based on CDC guidance and best practices. I would now like to introduce Deputy Chief Grigsby, and she can talk a little bit about Leesburg Police Department and what they're doing.
Thank you, Sheriff. Not to be redundant, but in addition to some of the measures that the Sheriff spoke about, the Leesburg Police Department has also suspended all tours of the police department, cruisers, and other equipment. The department has also suspended its ride-along program, and all food donations to the station have been temporarily suspended. Our officers have been directed to use social distancing and avoid unnecessary physical contact with non-arrestees. This may include not shaking hands with members of the public. We will take reports over the phone rather than in person whenever practical. And you may also see our officers wearing increased protective gear, such as face masks and rubber gloves. The officers have been directed to routinely wash their hands with soap and water, and we've also issued alcohol-based hand sanitizer in the event physical contact is necessary. Our officers have been issued sanitizing spray and wipes to decon their cruisers, equipment, and other police gear. In our station, we've increased cleaning and sanitizing of commonly touched surfaces, and we've also suspended public events such as Coffee with the Cop. Tentatively, the Chat with the Chiefs event scheduled for May 31st is going to be hosted on Facebook Live rather than a public setting. We are encouraging everyone to follow the advice of healthcare professionals, and please do not come into our station for routine services if you're sick or experiencing symptoms. You can reach out to us via telephone, email, or online. We will continue to work with our local, state, and federal partners, and public safety remains our #1 priority. Thank you.
Thank you, Chief. Now I'd like to introduce Chief Cindy McAllister from Percival. Chief?
Thanks. Thank you. Okay, good afternoon. We too are following the same protocol as the Sheriff's Office as well as Leesburg. Our priority function really is to protect the community as well as our officers. We want to make sure we keep as many of them well so that they can go out and serve the public. We too are canceling ride-alongs, Coffee with a Cop, books and badges, and following the same safety protocol as the officers and the deputies in our county. So, thank you.
Thank you, Chief. Now I'd like to introduce Chief A.J. Panabianco from Middleburg.
At risking being redundant, we're doing all the same things that all the localities are. It's important to remember that the officers cleaning up, staying safe, wearing protective gear is for your protection as well. So don't be offended when they do not shake your hand. We will continue all of our foot patrols. We will continue all of our community policing interactions as far as walking in the downtown area, but they will not be shaking hands as a precaution. They will have protective gear. They will not be riding around in it, but if you are exhibiting signs of being ill, or if you notify dispatch that you are ill or have traveled out of the country or one of the risk factors, the officer will don that protective gear as he or she arrives at your to respond. Thank you.
In addition to our emergency medical dispatch questioning, Loudoun County Combined Fire and Rescue System has implemented our pandemic response plan. That plan covers our preparedness phase, which we're currently in, and our response phase. and deals with everything to do with public safety. Our supplies in public safety remain high. We're in good shape as far as the supplies needed to combat this virus, and we continue to share all of our information with all of our public safety partners here that will keep us all safe and keep our response to you as the highest priority. We are in constant contact with our operational medical director with the Department of Health here in Loudoun County, Dr. David Goodfriend, as our county's health official. He provides great guidance, and we routinely interact with our emergency management personnel who have been deemed in charge of this incident for all of us to coordinate our public safety response. So again, confident that we will respond to every 911 call. Our services have not diminished. Our personnel remain intact, and we have great numbers of supplies ready to assist in any way we can.
Thank you, Chief. Well, thank you, and we're happy to take any questions. I have actually our staff of our majors over here, our executive staff, if we need to drill down on anything. So happy to take any questions you may have.
Sheriff, since one person in the county has been tentatively tested positive for COVID-19, are you familiar with the areas that person has been in the county, and are you keeping a close eye on those areas? Do we know if any other people have been in contact with that person that might be testing positive?
Sure. Step up to the podium. Is that best?
Yeah. Sure, yeah, if you don't mind, sir. Thank you.
So, we don't want to get into specifics about any one individual person
Sure.
out of a, concern for their confidentiality. The general practice is once someone is identified as potentially at a little bit elevated risk by the health department, they are requested to voluntarily quarantine at home and not travel outside their home. And from what I understand from the health department, people have been cooperating with that, for the most part. So this particular case, my understanding is prior to becoming a risk to the community, because there's a little bit of a buffer between when somebody gets exposed and when they may be sick and contagious, that the goal is to identify somebody at elevated risk prior to that time where they may be contagious, get them home, keep them home, and then monitor them. And in this case, once they were monitored, if symptoms were to develop, then testing would occur. That's the general principle that the health department is trying to apply. So the overall risk to the community from that one individual will be exceptionally low.
Thank you, Doctor. Okay. Do we have any other questions? Okay. Well, I want to thank you for coming out and appreciate you helping us get this message out. Thank you very much.